Calcium and magnesium are essential to the human body. Of course, we know that the bones are a big source of calcium. Most of us know that magnesium is necessary for proper muscle function. In fact, if they give magnesium to a person who has a heart attack within 24 hours, the risk of them dying drops dramatically. And so minerals, especially calcium and magnesium, are necessary for the contraction and relaxation of the muscles. So when many of us are deficient in calcium or magnesium, we get muscle cramps, especially after doing an activity or injuring the muscles. Many of you know what I'm talking about. You wake up in the middle of the night and you got that Charlie horse or the cramp. Or when you're playing basketball, you have this spot that just keeps cramping. And so chronic cramping is really one of the best tests to know if you have a deficiency in calcium and magnesium. And so there's another way of replicating this, and it's very easy, and we do it in our office in almost all patients. It's called the calcium magnesium blood pressure cuff test. And so here's what we do. We lay the patient down, comfortably either seated or laying down, and place a blood pressure cuff around the largest part of the calf. And then I begin inflating the cuff at a steady pace. I always tell my patients, let me know when you feel the onset of a cramp or a cramp-like pain. Obviously, as I fill up the blood pressure cuff, everyone feels pressure. It's not pressure, it's a cramp-like pain. And what I'm doing by doing this is I am replicating a trauma to the muscle. I'm putting pressure on the muscle. I'm measuring inflammation. And so what I should be able to find is I should be able to pump up that blood pressure cuff to 240 millimeters of mercury, ideally, before they tell me, oh, stop, it's cramping, it's pain. 240 is ideal. 200 is where we need to be. A lot of people, when I test this, they ask me to stop at like 140 or 150 millimeters of mercury on the blood pressure cuff. And I always know they're deficient in calcium and magnesium. And so there's a couple things you can do. First, take calcium magnesium. The best way to get this is in a chelated form and in a balanced ratio of calcium to magnesium. It should be in a 5-to-1 ratio. Our product, Calcium Magnesium Plus, is the perfect balance of calcium and magnesium. And so I encourage you to take that product if this test is showing up positive. Also, a lot of people don't absorb their minerals because they have poor stomach function. So a lot of times, if you take the calcium magnesium and it doesn't fix this issue, then you need to add in stomach juice so that you can absorb your minerals better. This is an amazing test. Doing this test can save your life. Literally, it can stop you from having a heart attack. It can stop you from breaking down your bones. It can stop you from having muscle disorders. And so many people, when they do this, they notice everything changes. They have less headaches, they sleep better, they're more relaxed, and of course they get less cramping. Do the test, fill the deficiency, and it will change your life.